Hello, I'm Dr. Maurie Markman from City of Hope, and I wanted to very briefly mention, note, highlight a truly extraordinary event in my professional experience as a clinical investigator now for almost 40 years in the area of the gynecologic malignancies. And that is the simultaneous publication in the New England Journal of Medicine of two landmark, paradigm-changing studies involving the management of advanced endometrial cancer. In my career, of course, I've treated endometrial cancer. But the paradigm, the algorithms, the strategies we've used have largely simply followed in the past what we've done for ovarian cancer. If platinums worked in ovarian cancer, they probably worked in endometrial cancer, and that was true. If paclitaxel had an activity in ovarian cancer, it probably would in endometrial cancer, and that was true. It took some time, but basically we use the same frontline chemotherapy in advanced or recurrent endometrial cancer as we've used in ovarian cancer, and on and on. That world has changed very much for the positive. Not only have pharmaceutical companies, academic investigators, individual investigators in the community setting seen endometrial cancer as a major priority, but we have exciting new developments. And very specifically, of course, the immunotherapeutic agents known as checkpoint inhibitors. In these two papers, one entitled Pembrolizumab plus chemotherapy in advanced endometrial cancer, and the second paper entitled Dostarlimab for primary advanced or recurrent endometrial cancer. Both, obviously separate studies, but both used checkpoint inhibitor plus chemotherapeutic agents, carboplatin and paclitaxel, compared to chemotherapy alone, as frontline therapy of advanced recurrent ovarian cancer, and demonstrated a statistically significant and, in my opinion, highly clinically meaningful improvement in progression-free survival in favor of the regimen that included the checkpoint inhibitors. Now, clearly, we will need longer follow-up to see both the overall magnitude of these therapies on overall survival, the duration of the magnitude, term that's often termed it's kind of the shape of the curve. Do we cure many more people? Do we delay time to progression and death? That remains to be seen. But the outcomes here are remarkably good, remarkably positive for patients, and absolutely change the standard of care in the management of recurrent or advanced endometrial cancer. I should note that that includes patients who have both evidence of mismatch repair deficiency and those patients, which is a larger patient population, who do not have evidence of deficiency. These studies demonstrated the benefit to the entire population of patients with, on the basis of data that we know, the greatest impact seen in the patients with evidence of mismatch repair deficiency, where the immunotherapy itself, not only in endometrial cancer, but in other tumor types, has been shown to be most relevant. Not exclusively, but most relevant. These are very important papers. I would encourage you, if you have an interest in endometrial cancer, certainly if you have an interest in immunotherapy, to read these important papers. They change the paradigm in the management of advanced endometrial cancer, and they clearly point us in the direction of where we need to look at future research efforts in the management of this group or class of gynecologic cancer malignancies. I thank you for your attention.